We are called to serve humanity.
Is one of the finest pharmacology teachers I have ever met during my years in School of Nursing and even my post-basic nursing specialty. He is also a registered nurse intensivist, and at the same time he is just recently being promoted to the rank of Chief Superintendent of Police. Join hands together as I invite here on stage Nurse Abdullahi Bala Rano. Sir, you are highly welcome.
To the topic of today, the nurse and the social media. The choice of this topic is not by accident. I'm sure most of us or all of us use this handset. There is no single person living or sitting in this hall that either do not have handset or have not had handset in the last future and the last time. Users engage with social media via computer, tablets or smartphones, via web-based software or web application, often utilizing it for messaging. What do we use social media for? We use it for social networking. You may be a bit confused. Social media, social networking, what's the difference? Social media is the name of what we do, of the system itself. But what we do with the social media, we call it what? Social networking. For everything we do, there are advantages and disadvantages. What advantage do we derive from the use of social media? Like I said, connectivity. Once there are times when you travel, you meet people, they will just look at you and say, sir, you are so person. They have identified you. I came back from a journey in the airport in Abuja, Nnamdi Azikiwe International Airport. Somebody said, Mariah, I just turned. Because I know I'm Mariah. And when I turned, he said, I'm your friend in Facebook. Proper use of social media can help you build your career. Build your career by using a lot of applications and sites. But unfortunately, we don't do that. What we care about is sharing things on Facebook and WhatsApp. Some of us have handsets, very expensive handsets. But the only thing we do is WhatsApp and some Facebook. Some they say they don't even do Facebook. But you don't go to other sites and search for knowledge. You can promote your business. You can promote your business. But the problem we have in promotion business here, you find a platform meant for scientific research. A metro will send you 100 types of slippers. They will send you one kind of buba. They will start selling. She has never contributed in any discussions. The only thing she does is what? Advertise her goods on a carton. Somebody snapped it and shared. That boy is now having, is a primary school boy, but he's having one of the biggest shops in Rano. Because people started trooping from all corners. The reason is people want to help people who they see in Facebook or on social media. They have left those who they have helped in their communities. But the social media, one of the advantages is you can get noble cause. You can create awareness. It helps in fighting crime. I'm sure some of us know this guy that was arrested in Dubai. He shared his personal life. If he's going to Dubai Mall, he's going to spend nothing less than $1 million. He spent so much. Hush puppy, have you? Hush puppy. There are many uncountable advantages of social media. We'll come to discuss a little more. The other side, which is the worst. For every advantage, there is disadvantage. Addiction. You find people, you are talking to them, but because they are so addicted to their phones, their attention is not even to you. I have been challenging people in the mosque. As soon as Imam says Assalamu alaikum, he will pick his phone. want to check whether he missed a call, or whether he missed a message from WhatsApp or whatever. And I say, you that is before someone that will give you whatever you need. You have all the time. Fraud and scams. We have series of challenges. A lot of people are scammed, particularly our nurses. This is one of the reasons why we even choose this topic. People will look at you, look at your antecedents, look at your source of income. They will scam you. Hacking, ruining reputations. People can easily ruin your reputation on Facebook because they can create whatever account. There are people who mistakenly had affairs with people, even with their family. They will now post it on the social media. Sometimes it is the women that will put it as status. They don't know that people can store their status and they will now use it. Your friend has friends. That her friend has other friends. And friends of your friends may not be your friends. They may be your enemies. Health issues. I think it is on social media that we learn bathing with salty water will prevent us from having not corona. It's not corona, it's Ebola. And they told us that if you take chitta with very hot chitta, there is nothing will bring corona near you. Social media can have people with health issues. Now they have started selling drugs, herbals, and what have you on Facebook. You will see somebody as fat as myself. They will show you one tea that he took it for 3 days. For just 3 days. He is now looking like Mala Masera. Social media causes death. This is a woman who has never seen Gulda physically. But she saw it on TV, in social media, and she said, that thing must be sweet. It must be so good. She asked her husband, please get a bottle of Gulda, at least for me today. The husband said, over his dead body. And she now reported him to me that, please, sir, ask him to buy a bottle. From that bottle, I will not add more. Why? Because she saw people taking it. Because they were advertising. They will sip it and they will smile. I now advise him, take her to Mami Market. Take her to Mami Market in the evening. Let her see people who took Gulda physically. If they sip, they will do the difference. They will frown because it's not sweet. So it glamorizes drugs and alcohol. It reduces family closeness. Anytime there is leave, my children want to go to Rano. One day I asked, the frequency of light in Rano is not as much as in Birnin Kebbi. The luxury I have in Birnin Kebbi is not in my mother's house in Rano. I now asked them why. They said, anytime we're in Rano, grandmother will tell us stories that you have not been telling us. They will tell us relationships between ourselves and others. Relationships that you yourself do not know. And that is what happens in our family now. We don't talk to our children. Once we are in the parlor, we watch film. Even as we are watching film, we do what? We do chatting. You will see somebody just laughing for nothing sake. Because he's not himself. Healthcare social media sites such as Mayo Clinic, please, if you have Biro, copy these things. Mayo Clinic, just type it. WebMD. Subscribe with your email. Subscribe. You show them different specialties of interest, areas of interest. They will tell you exactly what you need. Instead of wasting your money on just following people, reading stories, or going to Instagram of this Nollywood on Kannywood and what have you. Use your data wisely. Sometimes you speak, they will ask, is CNS? What an insult. They will see a metro will buy a very expensive phone. The only thing she does, La ilaha illallah, send this word to 20 people in two days. You will see miracle. Wallahi, I have done it. And she's still using that old Kia. Or what do you call it? Old car. She has not benefited anything, and she will say wallahi, because it's what? Copy and paste. Personal reading. How to know if your number has been linked. As soon as you enter a link and they tell you to share to 10 people, my brother, run away. Your life is in danger. As soon as they tell you, until you share with others before your benefit comes, you know others will also. That is how somebody shared with you. Your ATM number, your PIN, the 3 digits behind your ATM. Once you give them that one, your only action is to wait and start seeing alerts. No matter how much the money is, they will stash your account. Calls from abroad. Somebody called me with an unknown number. Not even an unknown number, it's an international number. Parcel arrival from abroad. A lot of us, we see fine Oyibo woman on Facebook. We send her friend request. Oh, they send us. They are not Oyibo, they are in Lagos. They are in Benin. If you see one guy, you will walk past me safe. You think they're a fine girl. Or you follow. They will tell you that they work in iPhone or iPad company. They are sending you a parcel. They will send you a packet, a bag, or a suitcase. They will even show you everything that it has arrived Lagos. What only they need from you is what? Clearance. Social media account hacking. We have people that they can easily hack your account. If you are on WhatsApp or Facebook or whatever, do what they call two-way verification. Me, I'm challenging anybody that can hack my account, either my MTN number or my Facebook account, to do it. I will pay him. Even me, if I want to if I want to register on another phone, they will ask me to do a lot of things that are annoying, but I know I have done that for myself. The advantage and disadvantage of social media can't be denied. It has a lot of advantages, it has a lot of disadvantages. It is fully up to the users how they use it smartly and actively. Our main problem as nurses is while we carry out procedure. David, on 4th of January, a lady asked on Facebook, what profession has the most rudest people? Wallahi, over 90% of the response, they said nurses. Nurses and midwives, hospital workers, nurses and doctors. Why? If she's listening to, what do you call it, voice note, patient relative is standing behind her, in front of her, telling her things that will help him and the patient. She's listening to this one. If you know you are a nurse who does everything you wanted without recourse to law and professionalism, you are a nurse. Try as much as you can to leave all things that you are not sure of. Be professional nurses. Thank you for your time.